In Washington state, some of the largest healthcare providers don't look like hospitals. The state recognizes a strict legal mandate to provide basic medical care to every incarcerated individual. But trying to deliver medical, dental, mental health, and pharmacy services inside a heavily secured environment completely breaks the traditional economics of healthcare efficiency. The result is a massive financial burden, and the actual price tag fluctuates wildly depending on which specific facility you look at across the state. Because these expenses are so volatile and unpredictable, correctional healthcare ends up dictating the budget of the entire justice system, rather than acting as a reliable, fixed operational line item. The financial strain begins with the patient baseline. Incarcerated populations enter the system with significantly higher rates of chronic illness, untreated conditions, and substance use disorders compared to the general public. Treating these conditions generates a massive surcharge because care cannot take place in a standard clinic. It requires secure facilities, requires constant guarding, and specialized transport. This chart shows the breakdown of operational expenses within a typical Washington jail, based on the state's jail bed rate study. Staff and security costs account for over 60% of total expenses, vastly dwarfing the cost of actual medical supplies. When routine preventative care is delayed due to these logistical hurdles, conditions worsen. By the time emergency or specialty care is required, the financial burden multiplies. A prison medical bill, then, operates primarily as a security and logistics invoice disguised as a healthcare expense. Washington splits correctional healthcare into two divergent models: state prisons on the left and local jails on the right. The state system operates centrally with on-site corrections and unified plans. Local jails operate as a fragmented patchwork, relying on variable staffing and third-party contracts. This fragmentation causes medical spending to vary drastically from county to county, creating severe, localized financial strain for individual jurisdictions. To alleviate some of this pressure, the state uses a policy called extraordinary medical placement. This acts as a relief valve, moving severely ill patients out of prison and into cheaper, more clinically appropriate care settings. An incarcerated person's zip code dictates their baseline standard of care, and it determines the degree of financial strain placed on the surrounding local taxpayers. To survive these mandatory, highly variable costs, correctional facilities rely on an administrative tactic known as cost shifting. A 2017 policy change ensures that upon incarceration, Apple Health Medicaid coverage toggles to a suspended state, bypassing permanent termination. This creates the 24-hour rule. If an inpatient hospital stay exceeds 24 hours, suspended Medicaid temporarily activates to pay the large bill. The patch is entirely administrative. State DOC facilities have the resources to process this Medicaid paperwork automatically. Understaffed local jails often fail to process the applications in time. When a local jail lacks the administrative resources to file the paperwork, local taxpayers are forced to absorb massive hospital bills that public insurance could have legally covered. Washington is now pivoting toward cost transparency and preventive medical measures to mitigate these massive, unpredictable state expenses. State investments in overdose prevention tools, like the distribution of naloxone, directly reduce the need for expensive emergency transport, extra guards, and intensive hospital care. Managing public justice budgets requires managing public health. Enacting proactive health policy outside the walls is the most viable method to control skyrocketing costs inside the walls.